Hi, everyone, and welcome to the November edition of the Lipedema Patient Roundtable, the best night of the month for many of us. And we're all saying hello and sending love to all of you out there. Please log on. Let us know you're out there. Let us know where you're logging on from. We have a rich evening planned for you wherever you're logging on from. We have two special guests. One, Dr. Leslyn Keith. So great to see you, Dr. Keith. She is an expert when it comes to occupational therapy, lipedema, obesity, and she is the director of research for the Lipedema Project. So welcome, Dr. Keith. So great to have you here. And Katie Glynn has been in our attendee list for quite some time now. And she is an expert when it comes to conservative therapies and treatments for lipedema. Her company is Three Bluebirds, KC, and we are so delighted to have you as a panelist tonight, Katie.
Thanks for having me. I'm excited.
It's a pleasure. It's awesome. Your audio seems just a teeny bit low, so if you're able to put your microphone up, that would be great. And then we've got our regular cast of characters, but nothing is really regular because, my goodness, the world tilted on its axis because the PGP got engaged since we last were together. Let's just have a moment and say, yay, there is the bride, there is the ring. So much fun there. So we definitely want, we see the special glow on your face, and a lot of it is coming from the inside, although you're having some really great results on the outside too. We want to get to that. Patty Cornute, Lipedema Fitness, is showing up tonight dealing with sciatica pain. And I asked a question which was kind of naive. Is this common for lipedema patients? And turns out there is a connection. So we want to get into that. And we also want to give heart bows to Patty for showing up, even though she's not feeling 100%. Our Lippy Butterfly is with us in the house, and she also is showing up with resilience and fervor. Susie Boshoff, we missed you last month. We're so glad to welcome you back. You've had some really amazing improvements with regard to inflammation. We want to go there. And Jenny Bogine, holding it down for lipedema and food sensitivities, and we are up and running, everybody. We see Mary Herzog and Edwina Angela Parsons and Alexis McKay and Sandy Darley and Amanda Hadaway and Lisa Maldonado and so many more. Welcome. This is November, a month to be grateful. And we are calling to mind our blessings. And then I was also thinking that this month of November begins with the word no. So what are you saying no to as lipedema patients, or just as people in general, for this upcoming holiday, which can be triggering for some people? What are you saying no to? Tell us in the chat. Leslyn, you are here, and I said, what do you want to talk about? Because there's so many places you could go. But since you're the director of research for the Lipedema Project, what is the research that is exciting you the most in the lipedema community? Tell all.
Well, and that's probably not a surprise to most people who know me, but the area of research in lipedema has just been exploding in the last 10 or fewer years. I mean, it's amazing all that's being done. Of course, we still need to learn more. But I was just counting up the papers that have to do with diet and specifically carbohydrate restriction and lipedema. And there's 22 papers that are out there. And two of those are review papers. They're doing a meta-analysis and a systematic review because there's enough studies out there about using carbohydrate restriction to help with lipedema. And so that's pretty exciting to me. But also what we're finding out about inflammation and lipedema. I was just trying to wade my way through a paper that's talking about endotoxins, which is basically when a bacteria explodes, those toxins from inside the bacteria then go out into your tissues. And it's talking about the role of those endotoxins in inflammation, and that this may be actually at a higher level in people with lipedema. And that's why we have so much inflammation. And it might also be triggering the adipose tissue expansion. So there's a lot to be excited about research in lipedema.
So I want to just sort of stop there. I mean, just the concept of bacteria exploding sounds like something out of a horror movie. And yet I saw your face, Susie, and you were just sort of nodding. Is this relating to some of your personal exploration and discovery?
I mean, I've been diving deep into the world of toxins and all the different ways that we get them into our bodies. We don't just eat them, we shampoo with them, we shower with them, we do so much stuff. I have my personal hypothesis on lipedema. I think lipedema is our body's way of taking care of us and protecting us and keeping us safe. I know that sounds insane, but hear me out. I think that the body gets hit with so many toxins that are so new to the last 60 years that our bodies, instead of just completely falling apart, they go, oh no, let me make some fat and encapsulate that piece of toxin and hide it away so that you're not going to be affected by it. I know it sounds crazy, and that's a super simplified version of it, but it absolutely, like, my cells have been wonky for a long time. I've had multiple doctors tell me that based on my panels, that my mitochondria is not functioning properly. Like, it is, obviously it's not so deranged that I'm dying, but it's bad enough that it makes me not handle anything well physically. I have the Ehlers-Danlos and all the other stuff, but like, it's been really, really rough. And so I was diving deep into the inflammation and low tox living, and I've been doing that for a long time. So when she said that, I was just, it's just more of the same. And we really live in a world where we're very much bombarded on all sides. And even when we think we're eating clean,
yeah,
we're still being bombarded.
What is normal is we are learning not. And you're getting a lot of validation in the chat, Susie. Of course, these are ideas. The roundtable is a great place to clearinghouse ideas. We're not saying anything is an imprimatur here, but it bears your interest and discussion. And obviously, Leslyn, the topic of a paper. Do you have any comments based on what Susie just said? Because I see you nodding.
Oh yeah, and right now through Lipedema Simplified, we're having a short course on detoxing, because just the type of thing that you're going through, Susie, is that, okay, so now I know that I have high inflammation. I probably, because of all these environmental toxins, how do I get rid of them? What do I do? And so that's what that course is all about. And we talk about the common comorbidity of lipedema also as mast cell activation syndrome. This is like an overreaction to, well, harmful toxins. And then your body goes crazy trying to deal with all that. And then you get almost a worsening of your symptoms because of this hyperallergic reaction. And that all comes to, again, that exposure and this almost hoarding of the inflammatory particles, the toxins in your body. It is there. A lot of them are saved in our adipose tissue. And then you start losing fat, losing weight and losing fat. We want to do that, but now you're releasing all these toxins. And so how do you protect your body as all that stuff's being released? Because it can make you feel pretty bad. So I know that you're learning a lot about that, Susie, so you could probably do a course on that.
Yeah, we could deep dive for hours. I mean, really, totally.
Wow. So you're having a good impact, which is losing, but yet it's releasing toxins.
Yeah. Well, so women who are postmenopausal and have lipedema, then they start losing weight and estrogens start getting released. And then you start having, you're feeling like, oh, maybe I'm perimenopausal. I'm not actually postmenopausal. I mean, so it's a lot of these things can happen when your adipose tissue starts being freed up. So, You need
Oh,
you need help with, you know, usually with a good medical provider that's going to help you through that stuff. And I'm just thinking too, you know, go outside the box, go to a naturopath, go to an osteopath, someone who's not going to do just traditional Western medicine. Because I don't think they know a whole lot about this. They don't know much about lipedema, and they might not know a lot about how you're reacting to all these toxins being released.
This
Can I
is so
interject
interesting.
something on that?
Yes, do that. And
So
then I want to go to Katie because I bet you have a perspective based on your treatment of patients. Go ahead, Susie.
I just wanted to say one thing on that. What Leslyn just said is everything. I have a naturopath that I see every single week, and she is literally, because I lost 40 pounds over the last year, and I have been, when I feel really horrible, I go see her, and she is alternating me between drainage and binders, drainage and binders,
Yes.
so that the
Yes.
toxins that are getting released from my adipose tissue, which is exactly what's happening, literally, it's like it's like you melt the fat and then suddenly you're loaded with more toxins than you know what to do with. It's kind of like that protection mechanism I was talking about, but we're back and forth all the time where I'm rotating through these depending on the cycle that I'm at. Anyway, I just, everything you're saying is blowing my mind because that's, you know, anyway.
Wow. So Katie, weigh in when you have a patient that is coming to you and perhaps they're dealing with this release of the toxins or the exploding bacteria. That phrase is going to stay with me. What do you recommend, as you are a conservative therapist and you want people to live their best life managing their lipedema in healthy ways? So what would you say?
Right. So when I'm treating with my patients and, you know, doing a lot of decongestion, myofascial release, softening the tissue, and then doing the manual lymph drainage, I find it fascinating, one, the way their body responds. You know, sometimes we'll hear that gurgling in their stomach where the lymphatic fluid is starting to move. Some of them can feel it in the back of their throat. So I always encourage all of my patients to drink a lot of water after our session. So that's my top tip. But, you know, even I find it so fascinating. I also try to take it slow, and I tell my patients to take it slow. So it's exciting to feel the changes and know that there are changes, but we also don't want to overdo it. So we have to find that happy medium, which can be difficult.
That's really great advice. And then PGP, right before we went live, you were telling me that you have had such an improvement in inflammation since your tonsillectomy.
Yeah. So with the tonsillectomy, I didn't eat for like a week and a half other than like mashed potatoes. And when I decided to like introduce foods back in, I decided to try like no sugar added, low sugar, zero sugar versions of the stuff that I loved. And then really limit my dairy. Like I switched to coconut or almond milk in my coffee. I cut back on my cereal because like that's where was my big milk thing. I refuse to give up cheese yet, baby steps. So like I scaled back on what I knew was two of my high like inflammatories because my taste buds were completely different now that I could breathe and smell. And I had kind of like detoxed from sugar for 2 weeks when I wasn't eating. And as of today, so my tonsillectomy was September 6th. As of today, I am down 41 pounds. And like, I literally just cut out sugar. I upped my protein because I live with a bodybuilder. And if I have to hear about protein, I'm going to lose my mind. But so I've upped my protein and have reduced the sugar and dairy. I mean, I still have cheese daily, so it's not like a huge reduction, but it's the sugar-free was really what like helped with my legs don't hurt. They feel like didn't have the lipedema pain like with touching, but by the end of the day, they would just be achy and like tight from inflammation again, which I contributed to like the lymphedema side of my legs, but they don't feel tight. They barely swell. All of my compression is loose, so I have to remeasure for compression. And I can like hold my legs up longer for like different exercises and stuff.
We, we are so excited for you on every level. Like it's all going on, PGP. And from the Lympha Press perspective, I was excited when you shared that you actually, so the good news about Lympha Press is that we have expanders so that our garments can fit any size person. And it's not about, we want you to have better quality of life, reduce pain, increased mobility, all that. It's a bonus that you've lost the weight, but now your expanders are contracting.
Yeah, so I took the 2 expanders out today. I have 0 expanders on the right leg now, and I only have 1 left on the left leg. And I know there was at least 2 other expanders from before that I took out, like after the saddlebag hip surgery. I know I like took a pair out then, and I didn't really realize how loose my Lympha Press was because I like high pressure. So like I crank it up high and it will tighten on me. And then I was like, the other day, I was like, I think I could probably like zip tighter. And so I just moved the zippers over at first and put it on my high pressure. And I was like, oh my God, like this does squeeze tighter than what I was doing. And then today I was like, I'm pretty sure I could make this even tighter. And so I tried it and took the expanders out and they zipped up without them. And so, yeah.
That's really good. And it's encouraging for people to know that there are expanders available. And then as you improve or as your body changes, you can remove them and it fills to fit. Bottom line is that that's why you didn't notice it right away, because it will fill up with the air to where your body is. So you didn't notice it right away.
I noticed it more on my torso, but I figured it was partly due to when he did the tummy tuck, I was so flat in the front, but I still had the hips. So to zip over the hips, the stomach was loose. So I just had kind of contributed it to that.
Yeah.
But the expanders are great for the fact that it can go down. So and then God forbid, if it would go back up due to menopause, like I will still be able to use it because I can put them back in.
Yep.
Like I'm not going to have to go back out and get another machine because I took out a part and now the part won't go back in.
Yep. Bingo. That's perfect. And I see you nodding, Jenny, and you've had some improvements with inflammation too. And then I want to go to questions from the audience because they know we've got our medical experts here and they want to ask some really good questions. But Jenny, tell us about your inflammation journey.
Well, a couple of things. I mean, back when I was first diagnosed when I was 59, 5 years ago, and went through decongestive therapy, but also really started looking at the foods I was eating and found Cheryl's group, the food sensitivities, and kind of started looking at those things. And when I changed the way I was eating, for instance, and PGP, I can eat hard cheeses, not soft cheeses. So I can eat skyr yogurt, not Greek yogurt. So test these things out because there's flexibility there, I think. But it made a big difference on the inflammation. I got my Lympha Press. I went through menopause and I had a gain and could put in an extender. But this year I've been, as you know, on a GLP for the past few months, and that's made a huge difference to that inflammation. And the heaviness in my legs, is so much better than what it was. It kind of instantaneously from that. It's been amazing from that end. But I too have been thinking, I think it's time to take out that extender that I have on my Lympha pants because I'm going to be good to go in that sense, because I can zip the zipper right up without any slowing down at all. So, but I think between the food and just changes that you make, and Leslyn's comments about the bacteria just blows my mind. And I immediately kind of tied it into what I think about in terms of mast cell all the time, because I react to everything. And that makes a difference in inflammation on a day-to-day basis. So,
yeah. Oh, thank you for sharing that. And this whole topic of GLP-1, I'd be interested to know what you think about that, Leslyn, and we can get into that more. But let's go to the questions from the audience. Amanda Hadaway, so lovely to have you out there, Amanda. She wants to know, she has been suffering, this is for Katie or Leslyn. She's been suffering with low back, upper butt pain, and it's AKA the butt shelf. Besides lipedema reduction surgery for relief, what do you suggest? Because she says it's killing her. Oh, we're so sorry. Thoughts, Katie first and then Leslyn.
Yep. So it could be a few things. It could be something as simple as fixing your posture. So a lot of us tend to stick our booty out. And if we tuck our pelvis under, we can have that better upright posture. So depending on what your job is, you could be sticking your booty out when you're sitting, when you're standing. So trying to tuck your pelvis under can make a world of difference. It's something that I have to work on all the time when I start to notice that. But also core strengthening. So when we strengthen the core, that can help support the lower back. So it doesn't have to be your traditional sit up on the floor. You could sit on an exercise ball. You could do standing core exercises. Of course, yoga is a great one to try out to work your core with different movements. So I would try more alignment, and I would try strengthening your core would be my top suggestions.
When you mentioned posture, I think we all sat up just a little bit straighter. So we were all adjusting ourselves there. Leslyn, anything you'd like to add to that question?
I think those are fabulous suggestions. I just think about, we were talking about this earlier with sciatica too, is that a lot of times it's that SI joint, your sacroiliac joint. And people think that it doesn't move. You have your sacrum and then you have your pelvis, and it actually does. That joint where your pelvis connects to your sacrum does move. And when it gets out of whack, it hurts. And kind of at that place where we're talking about that it hurts. And so going to a physical therapist that it knows about how to move that joint around and help you make it more stable, particularly if you have hypermobility that wants to stick out. And there's some easy movements and exercises you can go at home that you can do these at home that'll help get that back into place. And it's almost instantaneous that the pain can be gone. So going to a therapist that it really knows just what Katie's talking about, that posture, the core exercises, and working with that joint might take care of this problem for you pretty quickly.
Well, nobody is working out more than our Patty Cornute. She's inspiring me all the time with her all or something regimen. And is this something that you were familiar with? So does sciatica bother you on a regular basis? And thank you for being willing to share what's going on with you tonight.
Yeah, I definitely think since menopause, it's showed up more for me. Like everything seems a little looser. So making sure my form is, in line with the movements that we're doing has always been something that I work really hard. And luckily for me, my coach is my husband. So he sees me in recovery as well as in the movements. So we definitely work on making sure proper form. And he was working with me today on, different breathing techniques and stretching that I could try to breathe into that area and kind of expand and hopefully try to get it back into alignment.
Well, again, we really appreciate you being here, even in the midst of that. And if you need to move at all to relieve any pressure, feel free, because,
Absolutely.
You're our center square, Patty Cornute. Kara, what did you have to say about that?
For me, before surgery, when my butt shelf was like really prominent and painful, I found having like one of those roll pillows, like the roll logs, and putting it under the arch of my back when I slept, because the butt shelf touched the bed and my shoulders would touch, but the arch of my back wouldn't touch. And then I would wake up like hardly able to move because it would be locking up because it's arching more than it's supposed to while like I'm trying to relax. And I would have one on my desk chair or like wherever I was sitting. I think they were like all over the house because I was tired of carrying them around. So there was like the couch, the bed, and then I would just tuck it in like right above the shelf basically. And also, if you can stand it, like a massage gun or massaging that area to help break it up from being tight. And a lot of times I would just stand at like the end or side of the bed and lay like my upper half and stretch while standing and do like toe and calf raises just to like loosen that as much as I could from sitting before I climbed into bed at night. So those were like my pre-surgery loosening the area up, because that was my worst spot, especially the week of my period. It felt like I was hit with a sledgehammer across that spot.
Wow. Well, let's go to some, thank you for sharing that, PGP. And that's a great solution. So Victoria Bowden asks, totally different topic. And I've been curious about this too. Any knowledge or experience with grounding mats? She's seen them quite often advertised recently, and she's curious if anyone has any information on them and how they might be beneficial to patients with lipedema. Who would like to weigh in on that? Susie first.
Grounding is amazing. It is amazing. It's one of the most incredible things you can do for inflammation. I've used a grounding mat. The thing that you have to know about is if you're plugging it into an outlet in your house, if you have dirty electricity, you're going to have crappy sleep. And what I mean by that is, depending on how clean the electricity is that's flowing in your house, you're not going to get a clean grounding. It's stuff you have to look up and get more information on, but you can just take off your shoes and walk outside. You have to be on concrete, pavers, grass, sand, soil. You can't be on a wooden floor. You can hug a tree and you will get your body flooded with negative ions. There's actually a movie called Grounding. It was created by a photographer for National Geographic, and he stumbled across it quite by accident, and his story is hilarious and it's amazing. And he was in Alaska and he had a debilitating inflammatory condition, and he heard about grounding on some like Oprah Winfrey show or something like that. And he was like, I wonder if it would really work. So he like took off all of his clothes besides his underwear, climbed under his house, which was elevated because he was in Alaska, and then dug a little bit of dirt in the soil and like laid there for 4 hours. When you're desperate, you'll do anything. But he couldn't believe the difference it made in his body. So then he started deep diving into it, and he actually changed his entire town and helped people come back from some major things. I do it for 10 minutes a day, every day, no matter what I'm doing. Even if I go out on my front lawn, which we have crappy grass in Florida, it's terrible and it feels awful on your feet, but I do it anyway. But just connect with the earth for 10, 15 minutes.
I'm glad you said 10, 15 minutes, because the 4-hour thing, I just don't think I could pull that off. I am about ready to hug a tree because I want to hug someone. But the 10, 15 minute thing, I think I could maybe do that. Now, I saw a lot of smiles and nodding. Katie, the grounding thing, are you an advocate of that?
I mean, I believe in it for sure, and I do think it can help. I also believe in not always wearing tennis shoes and socks, so exercising, go barefoot, see what it feels like. But whatever feels good to other people is usually my answer. But I do think that there is something about feeling the earth, getting out of your shoes and socks, and feeling comfortable.
Interesting. And I have to tell you, I bought a grounding mat, but I think my electricity might be dirty because I did not have good sleep. So thank you for raising that, Susie. Any other thoughts on grounding? Leslyn, did you want to weigh in on this?
I really don't know anything at all about grounding mats, but I wonder if a part of the benefit is it because it's almost like a meditation that you're doing. And if you're doing it, as Susie says, at least for 10 minutes a day, every day, that's got to have huge health benefits just with that part.
It's actually, can I just tell you really fast?
Yeah.
So the earth, sand, water, all of these things, the trees, they actually have negative ions. In your body, you have cells, and when you have free radicals, you have unbalanced cells that have an extra positive, sorry, I used to remember this like very clearly back in the day, but when you flood your body with negative ions, which is what happens when you take a lot of antioxidants as well, it those extra negative ions attach to the free radicals and stabilize them. It's actual science. It's not like, this isn't woo-woo stuff. I'm not saying that meditation's woo-woo, because for sure it's calming. I'm saying that at a cellular level, it actually has an impact on your body, like legitimately. It actually brings down inflammation. So
Susie Beauchamp is back in the house. We missed you last month and you are on fire tonight. So thank you for bringing all that good information. I'm going to put that in my next to watch queue. I want to watch that documentary. And Angelique, we do not want to ignore you tonight. So feel free to pipe in about anything. What so far has piqued your interest, or what are you saying no to this November, Angelique?
Well, piquing my interest definitely right here with the grounding mat, because this is the first time that I've ever even heard of it. But then I'm reminded that our rock star, Dr. Karen Herbst, is a tree hugger at heart. So there must be something to the science there, like Susie said. For this November, well, what's going on with me really is I've been dealing with some cellulitis. And with that came like this really acute flare up, especially in my left leg, that really debilitated my mobility. So it took me back to like 5 years ago, inflammation wise and ability to walk wise and stuff like that. And it really got me down, really started to mess with me emotionally and psychologically. I'm, obviously hoping that I don't end up having to go back to a nursing home and things like that. All the different thoughts, obviously started circling around my head. And that is actually what I'm saying no to this November. I'm saying no to staying right there and saying more yes to walking in the gratitude that, number one, I'm not back in a nursing home. But number two, focusing on what I can do. Some of those things is like going back to basics that I, got rid of along the way. Not necessarily because I didn't need them, but I was excited and living life. And so I wasn't necessarily always thinking about the sugar, as Kara said, and I wasn't always thinking about the gluten, or right now I hadn't been elevating my bed like I should, because I started liking to sleep on my side. So so I'm saying more of the no's to like beating myself up about what happened, and saying yes to just focusing on what I can do to get back to better health.
Oh, beautifully said. And you bring up such an important topic. Thank you for sharing what you're going through, because we're with you, Lippy Butterfly. And cellulitis, maybe not everybody in our audience understands what this is and how it presents. Leslyn, would you speak to this? Because we want to share with our audience the warning signs and what people should do.
Yeah. And Katie, chime in on that too. But this is day one when a patient comes into the clinic. We make sure they understand the signs and symptoms of infection. And cellulitis is the type of infection that it happens a lot with lymphedema, not so much with lipedema. But if you have some lymphedema along with your lipedema, you got to watch out for it. And so that is redness, heat, pain. So more pain in that area where it's red and hot than it is on other, because you might already have some pain in the area, but more pain. And this general feeling of malaise, you feel like you have the flu. A lot of times you're not even seeing what's happening on your tissues. Maybe it's covered up, but the first thing, well, one of my patients, the first thing he noticed was chills. It's a hot summer day and he's got chills. And so then he checks out his legs. Oh, yep, got it again.
Wow.
And then the skin folds, a typical place where it shows up first. So yes. Someone was about to say something, sorry.
No. You froze for a moment, so I was concerned, but you're back, and that's good.
Okay, good.
So you get the signs. What is the first thing you should do?
Well, you got to immediately go to your doctor. If your doctor can't see you, got to go to urgent care. if your urgent care can't see, you're going to go to the ER, because these are one of the things that you will, within hours, you can be hospitalized. And I'd rather you go to see a healthcare provider and they say, oh no, it's just a heat rash, and it turns out to be a false alarm. Much better to have that happen than, like Angelique, ending up in the hospital because of this. You do not want to have to go to the hospital.
Yeah.
It is so much easier to get well at home. So we try not to get hospitalized, but if you are not seen within hours of you figuring out this is what's happening, then it could be too late, as far as that you could end up in the hospital, and we don't want you to have to go there.
And we're not trying to make anybody afraid, but we want to educate you so that you can be proactive. And we're just so glad, Angelique, that it was addressed, that you are home and that you're taking care of this. Katie, anything else you want to add to the cellulitis conversation?
I think it's also important to note with your medical provider, most likely they'll put you on an oral antibiotic, but when can you get back to your compression? So every doctor provider can be different on their guidelines, but I think that's also important because you don't want that infection to spread. Another thing to note is just that you might have increased swelling. So sometimes when I'm taking measurements in the clinic and I think, that's odd, you've had a pretty good little jump with their circumference, and then you feel it and you look at it and you're like, okay, it's pretty textbook, but it's important to know all of the signs and symptoms.
I have heard the technique of outlining with a marker the spot, and if it grows, then that's definitely a marker that you've got cellulitis. So thank you for that discussion. And Lippy, we are with you. So jump on in there. Go ahead, Patty.
Yeah, I just wanted to say, this has come up in my group before. It can be something as simple as you nicked yourself shaving. So many of us switched to electric shavers because of that. I was one who had a very severe reaction to, I couldn't even see the nick that had happened on my leg, and it's immediate and it's so fast acting, and you need to really be seen. So I've been using electric shavers ever since. They're not as close and smooth, but they definitely are. I've never had anything with an electric shaver happen like that.
Okay. Well, that's really good advice. Electric shavers. Go ahead, Angelique.
Can I say too, I guess one of the other explosive things for me tonight was talking about that explosive bacteria. Because I knew that I had a cut on my leg and I continued to get in the pool for my compression, but it was dirty. I think I talked about that last month. So it registered really strongly for me once I ended up at the emergency room because my doctor couldn't see me in XYZ. So I did go to the emergency room. It registered to me that really bacteria had gotten introduced to my body through that open wound. And in a sense, kind of like what Susie was saying, my body did kind of what it was supposed to do by blocking that bacteria down into the leg where it was introduced in, as opposed to letting it spread through my body, which is something that had happened with me before, where I had gotten cellulitis and soon it became a UTI and sepsis and all of those types of things. So I think that was something really good and something that I will definitely go back and look into even more with that explosive bacteria and what all of these different bacteria are actually doing to our bodies.
We've been doing this for 5 years and we still are uncovering brand new topics to discuss and go deeper with. And I just think it's such a beautiful public service, not just what's being said here, but all the support that is just a groundswell in the chat. Thank you, chatters, for all that you do. We are so thankful for you. You make the roundtables amazing. Let me go back to some more questions here because you mentioned water, Angelique, and an anonymous attendee asks, she was recommended to do water aerobics, but she finds that ever since she started, her SI joints are sore. What does that stand for, folks? What am I missing here?
Sacroiliac joint.
Yeah, well, that was not going to roll off my tongue. Absolutely. Has anybody else experienced this? And does anybody want to comment on this? And thank you for raising the issue, anonymous attendee. Go ahead, Patty.
Yeah, in the pool, you definitely have so much more freedom of movement because you're not having the same amount of gravity on you. So your limbs can definitely slip out easier. If you have hypermobility like I do, I have to be careful when I do laps that I'm not over kicking my legs. And I tend to do more upper body because I can easily, my hips do that, and it can be extremely painful. So yeah, I do see where you have to be a little bit more, and it's fun because you can jump and you can do all kinds of stuff in the pool that you can't do on dry land. So you really want to experiment and go to town. And then I just have to remember that sometimes, see, reel it in a little bit.
Okay, got it. I see you nodding, Leslyn. And so anybody else want to say anything on this before we move to Sandy Darley's question?
Can I just say one thing since I'm
Yeah.
obsessed with the water? So the reason that going in the water is so important for you is because it acts like when you're in 3 feet of water, it's twice the compression of the highest medical grade compression that you could physically put on your body. Okay. So when you're walking, just gently walking, you are doing so much for your body. And you shouldn't get that reaction. But if you're doing water aerobics, and like Patty said, where you feel so free, and then you're doing stuff that your body really isn't ready for you to be doing all day, every day, because I get that same thing. And then I also get, I don't know if you guys get that butt cramp that's like, I don't know if it comes from my hip, but it's in the middle of my like butt cheek where if I had a dimple, it would be there, but I don't. And it's so painful. It's like a Charlie horse in your butt cheek. Angelique's laughing her ass off. She knows exactly what I'm talking about. So I'm just saying, just gently walk across the pool and don't stress yourself, and you will be doing so much more for your body than you would have done otherwise. You're moving your lymph, your exercise. It's great. Okay.
Karen Ashforth once shared this example because Lympha Press had at one point gotten some pushback. The pressures are too high. When you're in the water, you're getting intense pressure, and the pressure is what does the job. So yeah, we just can cross that one off the list. Let's talk about abdominal massage. Sandy Darley wants to know, is deep abdominal massage appropriate for those with lymphedema and lipedema? Oh, you're just waving hi, Angelique, or did you want to weigh in on that?
Just waving hi to Sandy.
Who has any thoughts? Leslyn, do you have anything? Go ahead.
Yeah, well, and I've been doing a lot looking at central lymphatic dysfunction. And with that, we get this leakiness that actually where you're filling up your abdomen with fluid, or fluid is going backwards, it's refluxing and going the wrong way. And so it's, I think, imperative for not just lymphedema and lipedema, but also if we have a central problem with the lymphatics in the trunk, the deep abdominal stuff is really crucial, but it may not be something you can go right into. You might have to work into it. Some people have pretty low tolerance for doing pressure around the abdomen. If you have any abdominal aorta problems, you're not going to want to go really deep around there. For some of you, if you feel like if you push in on your belly, can you feel your abdominal aortic pulse? You should not be pushing deep on your abdomen in that case. But for most people, doing that deep abdominal work is going to be so important and really beneficial to your condition. But I would say just go cautiously, go gently, and see what your tolerance is.
So you and Katie are simpatico here because I see just Katie nodding away. So
Of course. And, I love how you say just start gentle, listen to your body. Don't just dig in and start going really hard at it. Of course, I teach a lot of my patients how to do diaphragmatic or belly breathing, which, is that internal manual lymph drainage. So getting it not only internally, but externally to really get that fluid. I compare the abdominal area as the mothership. So we have to get that moving, but you got to go gentle and listen to your body.
the mothership. Wow. Okay, go ahead, Patty.
Sorry. I just got the Stop Chasing Pain Mojo ball, and I put it right at the underneath like my rib cage there by the sternum, and it's the minimum level, and I just feel so amazing. And I just kind of, it's a ball, so I just kind of, it's a massage ball if you don't know, and I roll it down to my belly button. I go around my belly button. I go over to where my my inguinals are, and just you can immediately start to feel things moving, and it's just been really wonderful so far.
Mhm.
So we've got a boatload of more questions, and we're running out of time. We don't want to do this. This show is fire. So
Can I make just a really happy announcement to make sure that I get to say it before we run out of
yes,
time? Because I am just so thrilled that Patty Cornute has agreed to be on the board of directors for the Lipedema Project. So she is joining us at Lipedema Project, and we are so lucky and thrilled to have her. So thank you, Patty.
oh, I'm so glad you made the announcement. And any organization that has Patty Cornute is better for it. And we know we are certainly better for having you on our panel, Patty. That's beautiful. Thank you, Leslyn.
And this is the first place at the roundtable that it's being announced. You guys are all finding out this first.
We love breaking news. We love breaking news, and we love making people's nights. And we have a few more questions. Candace Smith is fairly new to us. Hey, Candace, we're so glad you're with us tonight. Lots of love to you. She is new to the conversation. She's new to her Lympha Press. Awesome. She wants to know about using the vibration plate and the Lympha Press. Now, how many of you with your Lympha Press also use a vibration plate? Yep, we got lots of tools in our toolbox. So any recommendations on using both? Anybody want to weigh in on that?
I will. Yes. The vibration plate's getting a lot of attention right now, which is fun. I bought mine a few months ago and I enjoy it. My kids enjoy it. But when it comes to using the vibration plate, like any tool, I think most of us therapists will say start slow, listen to your body. I love it before people exercise, kind of warm up. I would do it before you pump to kind of start getting the tissue softer. I like it when my patients wear compression garments, if that feels good, because it gives that support to the lymphatic system and the lipedema tissue, makes the tissue work a little bit harder against the tight compression. Some feedback is that doesn't feel good to me, and if it doesn't, that's okay too.
What about the itching?
I've done a little bit of research, and Leslyn, you might have read more, but that it's histamines being released. And kind of the same thing, you have to build up a tolerance. So starting slow, once you feel that itchy, maybe you stop there and then slowly start increasing your time and the vibration.
So we had another question about, let's go to Jenny first, and then we want to talk compression stockings. Go ahead.
So I use both, but I generally do the Lympha pants at night at the end of my day. I do the vibration plate in the morning, and I tie it in with, because I have no cartilage left in my knees. Thank you, lipedema. And because I'm really prone to cellulitis, I'm not going down the path of working on replacing them. So when I use the vibration plate, I sit on a high stool so that I get some stretching out of the knee and the fluid can move through my joints better. But I actually just this year have started adding upper body strength training while I'm using the plate. And I'm up to doing the plate after 2 years for like half an hour at a stretch. But now I've got a really strong upper body workout going on the same time. And when you were talking about posture, I used to slump when I sat on it. But just this year, I've been really conscious of trying to sit straight and, pull my pelvic muscles in when I'm doing all this stuff. So, whatever works. Patty's thing of all or something. It's so true.
I love that. It is a great mantra. We love that. So questions about compression stockings. How many of you use compression stockings while you use your Lympha Press? Anybody? No. And they're wondering if that is appropriate. Now, I know that some people use unique add-ons like foam and other components. I'd love to hear from the medical professionals on this. Compression while using Lympha Press.
I would use a padded, chip foam type garment inside a pump, but I would not use like one of your flat knit or circular knit stockings that you would wear during the day. I would not use that. I would be worried about it sinking into skin folds and pressing it in there, and you might come out with a funny shape.
Yes.
I've seen patients that have this type of a look because the stocking sunk into areas and you don't want that reinforced with the pump. It is can be very beneficial with, and I would say a gentle chip foam. I wouldn't want to use a closed cell chip foam inside the pump. I think that's too aggressive. So yes, you're trying to amplify the pump maybe a little bit, or if you have some fibrosis, you're trying to help break that down. But as Patty's been saying too, cautious, gentle, see how you tolerate, and then maybe you can up it a little bit if you do okay. You're looking at how does your skin respond?
Yeah.
Are you getting itchy? Are you releasing those histamines? Maybe that was too aggressive. Back off. Be kind to yourself.
Love that. Let's highlight that. Be kind to yourself in every way. And this concept of it fills to fit, you don't need to help that. It will fit you. It will conform to your body. You don't need to try to help it along with compression underneath. So thank you for stating it far more medically superior than I could. But Katie, did you want to add anything to that?
I completely agree. Yeah, I would never recommend wearing compression garments with the pump. Also, it's kind of like manual lymph drainage. We don't have you guys wear compression garments when you're doing self-manual lymph drainage, or we're doing it. You want to get down to the tissue, and you want to make sure you know what's going on underneath versus the compression garment. It could possibly be digging in or causing things that we don't want.
Very good. Ray Wood is in the audience. Hey, Ray, it's so nice to have you here. And he is saying many use Lympha Press for Derkums and lipedema. I wonder how we could encourage more of our members to try the Lympha Press. And I would say send them our way. Invite them to go to the Lympha Press website, lymphapress.com. You can hit the contact form. We will connect you with a local representative that can walk you through. And we're not just going to like order a pump and, you got to figure it out. We do your first therapy session with you. And we follow up with monthly roundtables to help answer your questions. And the rep's phone number is right on the pump. So if you need anything, so we're here to help. Part of what we'd love to do, and invite your friends, Ray, to come to the roundtable. This is a great way to be introduced to the concept of pneumatic compression therapy. Not all pumps are created equal. The Lympha Press is unique. It is indicated for lipedema by the FDA, and so many people get lots of relief from it. So thanks for that question. Going back to cellulitis, Debbie Bracey wants to know what cellulitis feels like, and does it cause itching to the skin? She says, how do you treat it at home? And we want to underscore the fact that you don't want to treat it at home. You want to get medical attention. But what does it feel like? Who would like to speak to that?
I'd love to have someone who's had it, cellulitis, and speak to exactly what you felt. Yes.
Go ahead, PGP, and then Jenny.
So I got it after a surgery, and it was hot to the touch, like hotter than I normally am, and pinker than my legs normally get, and almost like an orange peel texture. Like the skin texture changed a little. Like you could see the pores more. Like it just seemed like it was stretched and like an orange peel. Really, I think was probably the closest look wise to the texture of it. And it was more solid to the touch than like the rest of the area. Like that section was like really letting you know that there was something going on underneath that layer of skin, and you should look at it. Like it lets you know it's there. And it does, as it progresses, you do feel like the flu-like symptoms of the chills and like because again, I'm never cold, and I was like freezing and like just not feeling 100%. And at first I brushed it off to recovering from surgery. And then I saw like the leg. It was like, oh. And I had to go to the ER because it was a Sunday.
Oh,
So
thank you.
Mhm.
That's pretty explicit. And what about you, Jenny? Similar?
I actually, yeah, her description of it is really spot on. But I had my cat veered left when I went right, and she kind of just put her paw out, and I couldn't even see a mark, but I knew that she'd broken the skin. And within hours, I could see a red spot. I could feel the leg was warm in that spot. And within a day, it had expanded. And I called the doctor. And when I went in, they gave me some oral antibiotics. And he said, well, let's see. I don't know. This should work. But come back to me in 3 days if it doesn't. And in those 3 days, I started getting the chills and the fever and feeling not well. And the spot continued to not get better. And when I went back, I went to the hospital. He sent me right to the hospital. I was there on intravenous antibiotics for 11 days. This is not something that is going to cure itself at home. If it happens, go to a doctor. I can't emphasize that enough.
Yeah, absolutely. Go ahead, Angelique.
For me, in addition to what Kara said, there are two things that kind of like point out to me like every time that I have cellulitis. One of them in particular is because I'm African American. I kept looking for reddening of my skin, but it's actually for myself. I get dark in that area. My skin sometimes will turn black, and if the infection is really bad, it'll turn black and start to like kind of flake off. So that's one of the things for myself. And then I have this like classic cellulitis sting that I get like right there in the flesh of it. It's kind of similar to the nerve pains that, I tend to get with my lipedema, but they're stronger. And I know that they're abnormal in some sort of way. So once I see that I'm getting dark in the area and I get that sting, I try to head off the chills because I fear that when I get to the chills stage, I might start blacking out, which is something that has happened before. I might lose consciousness and things like that. So I'm trying to catch it at the sting and the skin changes.
Excellent. Thank you, Angelique. One more question, and then I want to go around the round table and either leave our audience with a word of encouragement, something you're thankful for, or something you're saying no to, or recommend them saying no to. The final question is from Denise Leva. I think that's how I pronounce your last name. Can swelling in the abdomen cause issues with a hiatal hernia, and maybe tight compression garments? Can they cause issues with the hiatal hernia? And you're nodding, Leslyn.
Yeah, and I don't have lymphedema, but I do have a hiatal hernia. And I was going to see a chiropractor that did, it was putting me into traction device to try to straighten my scoliosis. And I went there right after breakfast. A strap was going right across that area where your hiatal hernia is, your esophagus goes into your stomach. And I said, you got to get me out of this thing. This is not good. What's happening right now? So I do think that sometimes, especially if it is right after you've had something to eat, that compression right across the hiatal hernia can be very, very uncomfortable. So something to consider. Even doing, some people do intermittent fasting and they just don't eat in the middle of the day. So you have breakfast, you put your garments on, you don't eat until, later in the evening, and your garments are off. You might, if your hiatal hernia is that severe, you're that sensitive, you might have to do that, or very, very small meals.
This conversation tonight has been rich. Really good, really insightful, and lots of good takeaways for everybody. So with that, I want to thank especially our guests, Leslyn and Katie, and I'm going to give you the floor first. How would you like to close out the program? Is there anything you'd like to encourage our audience with, or anything that you're especially thankful for? Leslyn first and then Katie.
Okay. I'm thinking of just some couple things that came up tonight, and is being kind to yourself. Go gently. And sometimes we feel like we've just got to work so hard and we've got to push the envelope. But let's have a nice holiday season and just go gentle, and see what your body is happy with and have a good time.
Oh, well said. I love that, Leslyn. We appreciate you being here tonight. And Katie.
Yes, my best advice, especially going into the holidays, is that not every day has to be perfect. And knowing, whether you wear your compression garments for 2 hours and then you go to your family event, or you eat a healthy breakfast, knowing that you're going to indulge in a little bit in your evening meal. But just a little bit is something. And so don't be too hard on yourself. Kind of the same note as Leslyn.
All or something, it sounds like there. I love that. So Patty Cornett, I'm going to go to you next. What would you like to leave our audience with?
I want to remind everybody that November is also Caregiver Awareness Month, and I know a lot of us have people in our lives that really help us on our journey. I am putting an art piece together. If you have a name of somebody that you would like to have added to this piece that I'm making, please let me know at Lipedema Fitness, and I would be happy to add them to the list.
Oh, so beautiful. I'm so glad you snuck that in. We needed to talk about that. That's excellent. What about you, Jenny?
I'm going to say no dehydration in November because I actually have had a couple of UTIs this year. And so my medical team and I, this is one of the things we're working on. So I really have been drinking a lot of water. So yeah, no dehydration. Yes, water.
Perfect. Susie.
I think my big mantra is no letting other people steal my joy. That's that. I know what I know. I love my people and I spend more time with them. And if you make me feel like shit, I'm not going to have you in my life. So no shenanigans, just all the love. Like keep the people that matter close and hug the people you love the most. And, no
Beautiful.
shenanigans.
Beautiful. Yes to boundaries, no to drama. I'm hearing a lot of that in the chat. Angelique and then Kara.
I'm also saying no to bullying for this November. I'm with Susie on this absolutely no bullying campaign. So absolutely no bullying, no mistreating people just to make yourself feel better, and standing up for the people that are getting bullied, whether they're online or getting bullied in the legal system. Absolutely standing up to bullies this November. No bullying.
I think the biggest bully is fear too. And I don't
Yeah.
want it. That's mine. I'm saying no to fear and the what ifs that awfulize a bleak future. That's what I'm saying no to. And Kara.
So I'm just saying no to feeling like I have to be the one to do everything, and which is a struggle for me. And then it would be yes to allowing people to help me. Like, it's been like an adjustment having like Levi around and him being like, sit down, let me bring you this or let me do this. And like, because I'm not used to that. I was on my own for so long. And so it's been a struggle, but it's definitely for the best. And there's nothing wrong with like sitting down and letting someone bring you a plate of food for Thanksgiving and while you elevate. And so, yes to the princess treatment. So.
Well, sign us up for the Princess Program. And with that, we are so out of time. We're over time. But you know what? We just love you. We love spending this hour with you every month. To our dear friends out there, everyone from Susan O'Hara to Casey Grosvenor and Mary Herzog, and I can't mention all of your names. Please know we are thankful for you. You matter. You are seen and heard, and you make a difference. Have a beautiful and wonderful Thanksgiving holiday with love from the Lipedema Patient Roundtable. Bye-bye, everybody.